Hello, my name is Joseph Wager.
And my name is Allan Ridings.
We work for the Cooperative of American Physicians, the Risk Management and Patient Safety Department.
And today's topic is regarding weights and measures, and this is eTips. What actually is the difference? Well, we have to look at what's happened in the world. The United States is the only country in the world that has not transferred over to the metric system. Well, how does this affect you? Well, in your electronic medical record, you're going to find that patients are being weighed in pounds and ounces and have medications in the metric system, milliliters. How do we overcome that?
One of the things you need to do is train your staff on how to measure correctly, whether that measurement is in metric or US. And the other thing is look at the system. What is the system providing for you? Is the system based on metric or is it based on US? One of the recommendations we have as an organization, have one or the other. Don't go back and forth. If you're used to using the US system, use your system with the US system. If you're used to using metric, go with the metric system.
Be very cautious when you're giving medications out, because what somebody is going to receive as a medication for 100 pounds is different than 100 kilograms.
The care of the patient is determined by the weight. For example, pediatrics will weigh their patient to determine the amount of prescriptions they provide for their patients. The hospital setting follows in the same format. Patients are prescribed on kilograms versus pounds. When in a hospital setting, kilograms are used to determine what amount of medication is being given to their patients.
When you receive those paper records or electronic records from the hospital or other entity that's treated the patient, make sure that you verify which weight system was in use, pounds and ounces or kilograms. Also, when you are importing that, make sure you teach your staff to verify everything before they accept it. You, the physician, are the ultimate person to review and sign off on this information once it's in your system. So let's paraphrase what we just heard regarding weights and measures. Make sure that your staff are aware of the differences between pounds and ounces and centimeters, meters, and liters. Those are very important topics regarding weights, measures, and what is actually administered in the drugs to the patient.
One important factor is always control your measures in the correct dosage. You look at the weight based on the kilogram, always measured in kilograms. Don't go back and forth. Height should be also measured in centimeters versus inches, and make sure that you follow the same format, US versus metric. As always, choose the correct weights and measure system for your practice.
This has been another eTips episode. Please join us on our website, capphysicians.com.